Imagine waking up one morning, reaching for your coffee mug, and watching your hand shake so badly that the coffee spills before it ever reaches your lips. You tell yourself it's just nerves. Maybe you didn't sleep well. Maybe you had too much caffeine yesterday. But then, it happens again, and again, and again. And one day, someone across the table looks at you and asks, quietly, with concern in their eyes, "Are you okay?" That question changes everything. Because for over 10 million Americans, that moment isn't just a bad morning. It's the beginning of a journey into one of the most common, yet most misunderstood, neurological conditions in the entire United States. A condition that can steal the simple joys of life. Buttoning a shirt, signing your name, holding your grandchild's hand without trembling. And here's the part that will shock you. Most people who have it don't even know what it's called. Welcome to Hidden Health Facts. Today, we're uncovering the truth about essential tremor, what it really is, why it happens, how it's diagnosed, and most importantly, what you can actually do about it. Stay with us, because what you're about to learn might change the way you see your own body forever. Wills. So what exactly is essential tremor? At its core, essential tremor, or ET as neurologists call it, is a nervous system disorder, a neurological condition, one that causes rhythmic, involuntary shaking, most commonly in the hands. But it doesn't stop there. It can affect the head, causing a subtle back and forth or side-to-side nodding motion. It can creep into the voice, making it sound slightly tremulous or unsteady. It can reach the legs, the torso, even the jaw. And here's the number that stops most people cold. The National Institutes of Health estimates that essential tremor affects somewhere between 7 to 10 million Americans. Some researchers believe the true number is even higher, because so many cases go undiagnosed or misdiagnosed for years, sometimes decades. That means there are millions of people right now. Maybe someone in your family, maybe someone you see every day, maybe even you yourself, who are living with this condition without truly understanding it. And the confusion doesn't stop there, because one of the biggest problems surrounding essential tremor is that people constantly mistake it for something else, something far more frightening: Parkinson's disease. The moment hands start shaking, the mind immediately jumps to that word, Parkinson's. And while the fear is completely understandable, essential tremor and Parkinson's disease are fundamentally different conditions, different causes, different patterns, different outcomes. We'll break down exactly how to tell them apart. But first, let's go deeper. Let's go inside the brain itself, because that's where the real story of essential tremor begins. Picture your brain for a moment, not as a mysterious organ you can't understand, but as the most sophisticated communication network ever built. Billions of neurons, firing signals at lightning speed, coordinating every single movement your body makes. When you reach for a glass of water, your brain doesn't just send one simple command. It sends a cascade of coordinated signals, from the motor cortex, down through the cerebellum, through the thalamus, and out through your nervous system, all in perfect synchrony, all in fractions of a second. Now imagine that synchrony breaking down. That is what happens in essential tremor. The cerebellum, the walnut-sized structure at the back of your brain, the region responsible for coordination, balance, and fine motor control, begins misfiring. The signals it sends become irregular, the rhythm breaks, and what you feel in your hands is the physical echo of that misfiring. A rhythmic tremor, typically oscillating between 4 to 12 times per second, invisible to most people in mild stages, but impossible to ignore as it progresses. But here's something most people never realize. The tremor in essential tremor is what neurologists call an action tremor, meaning it appears when you are doing something, when your hands are in use, when you're reaching, lifting, writing, eating. This is one of the most important distinctions between essential tremor and Parkinson's disease, because Parkinson's tremor is typically a resting tremor. It shows up when the hands are completely still, and often improves when the person reaches out to grab something. With essential tremor, it's the opposite. The stillness brings relief. The movement brings the shake. Understanding this difference can literally change someone's diagnosis and their entire life trajectory. But that's only part of the story. Let's talk about genetics, because essential tremor has a family secret. Researchers have discovered that essential tremor runs strongly in families. If one of your parents has it, your chances of developing it yourself are significantly higher. In fact, Studies suggest that genetics may account for up to 50% of all essential tremor cases. Scientists have identified several gene mutations associated with the condition, including mutations in genes like LINGO1 and ETM genes, but the full genetic picture is still being mapped. This is one of the most active areas of neurological research today. And while essential tremor can appear at any age, yes, even in children and young adults, the risk increases significantly with age. The condition becomes much more common after the age of 40, and its prevalence rises sharply in people over 65. This is why you'll often hear it referred to as senile tremor in older medical literature, a term that is now considered outdated and inaccurate, because age is only one piece of a very complex puzzle. Now, let's talk about the triggers. Because even if someone has the genetic predisposition, certain things can make the tremor dramatically worse. Caffeine is one of the most common culprits. That morning coffee that millions of Americans depend on? For someone with essential tremor, it can amplify the shaking significantly. Stress and anxiety are powerful triggers. The nervous system is already misfiring, and emotional stress throws gasoline on that fire. Fatigue makes everything worse. Sleep deprivation reduces the brain's ability to regulate movement, and the tremor can intensify. Certain medications, including some used for asthma, mood disorders, and even heart conditions, can either cause or worsen tremor. This is why a complete medication review is always part of any neurological workup for tremor. And here's something that surprises almost everyone. Alcohol can temporarily reduce essential tremor. Some people discover, almost accidentally, that a glass of wine makes their shaking better. This is actually used as a diagnostic clue by some neurologists. But, and this is critically important, using alcohol to manage tremor creates serious risks. It can lead to dependency. It is not a treatment, and it is never recommended by any medical professional. But that's only part of the story. Let's talk about the hidden symptoms. The ones that never make it into a simple internet search. Most people think of essential tremor as just a hand-shaking problem. But for the millions of Americans living with this condition, the reality is far more complex. Voice tremor is one of the most emotionally devastating hidden symptoms. Imagine your voice cracking and quivering whenever you speak in public. Job interviews, family dinners, phone calls. Every word becomes a reminder of something you cannot control. Head tremor, a rhythmic nodding or shaking of the head, can be mistaken for a gesture of agreement or disagreement. People don't realize it's involuntary, and that misunderstanding, that social awkwardness, creates layers of emotional pain. Writing becomes a challenge. Tasks, like filling out forms, signing documents, addressing envelopes, things that seem effortless to others, become sources of anxiety and frustration. Eating in public becomes a dreaded ordeal. Soups, liquids, anything that requires steady hands becomes a minefield of embarrassment. Some people stop eating out altogether. They start canceling plans, withdrawing from social events. And that isolation is where essential tremor crosses from a physical condition into a deeply emotional one. Research published in neurological journals has consistently shown that people with essential tremor experience significantly higher rates of depression and anxiety than the general population. Not just because of the tremor itself, but because of the shame, the withdrawal, and the feeling of losing control over your own body. Now let's address the myths. Because essential tremor is surrounded by misconceptions that cause real harm. Myth number 1, it's just normal aging. This is dangerously wrong. While tremor can become more common with age, essential tremor is a diagnosable neurological condition. It is not simply an inevitable part of getting old, and dismissing it as such means people miss out on treatments that could genuinely help them. Myth number 2, essential tremor always gets worse over time. The reality is more nuanced. In many people, essential tremor does progress slowly over decades, but the rate varies enormously from person to person. Some people have mild tremor for their entire lives. Others see more rapid progression. There is no single predictable path. Myth number 3, there's nothing you can do about it. This could not be more wrong. And that brings us to the most important part of today's video. Because there is hope. Real, medically proven, life-changing hope. Let's talk about what happens when someone finally walks into a neurologist's office and says, "I need help. My hands won't stop shaking." The first step is always diagnosis. And unlike many conditions, Essential tremor doesn't have a single definitive blood test or brain scan that confirms it. Instead, neurologists use a combination of clinical evaluation, history, and targeted testing to build a complete picture. The neurological examination is the cornerstone of diagnosis. A neurologist will watch how you move. They'll ask you to hold your arms outstretched, draw a spiral, pour water from cup to cup. They'll observe whether the tremor appears during movement or at rest. They'll examine your reflexes, your balance, your gait. They'll ask about family history, about medications, about caffeine and alcohol use, about when the tremor started and how it has changed. Blood tests are used to rule out other conditions. Thyroid disorders, both hyperthyroidism and hypothyroidism, can cause tremor. Vitamin deficiencies can contribute. Liver disease can cause a distinctive type of tremor called asterixis. These must be ruled out before essential tremor can be confirmed. Brain imaging, MRI scans, can be ordered to rule out structural causes. Strokes, tumors, multiple sclerosis, all of these can produce tremor symptoms. When the MRI comes back normal, it's actually reassuring. It narrows the field and points toward a functional, neurological diagnosis like essential tremor. In some specialized centers, a technique called DAT scan, or dopamine transporter scan, can help distinguish essential tremor from Parkinson's disease by imaging the dopamine system in the brain. This is a powerful tool when the clinical picture is uncertain. Once the diagnosis is confirmed, treatment becomes the focus. And the good news is, the options have never been better. Let's start with lifestyle modifications. Because before any medication is prescribed, there are things people can do right now that make a real difference. Reducing caffeine is one of the most impactful changes. For many people with essential tremor, eliminating coffee, energy drinks, and even certain teas leads to noticeable improvement in tremor severity. Managing stress is equally critical. Mindfulness-based stress reduction, meditation, deep breathing exercises. These aren't just feel-good suggestions. They directly reduce the nervous system activation that amplifies tremor. Prioritizing sleep, getting adequate, consistent rest is one of the most powerful neurological regulators we have. Poor sleep makes tremor worse. Good sleep gives the nervous system space to recover. Exercise, particularly activities that improve balance, coordination, and core strength, has been shown in multiple studies to help people with essential tremor manage their symptoms. Yoga and Tai Chi have both shown promise in clinical settings. Occupational therapy is one of the most underutilized resources for people with essential tremor. Occupational therapists specialize in helping people adapt their daily lives using weighted utensils that reduce tremor during eating, modified writing tools, assistive devices for buttons and zippers. These aren't workarounds. They are genuine quality-of-life transformations. Now let's talk about medications. Because for many people, lifestyle changes alone are not enough. The first-line medications for essential tremor in the United States are propranolol and primidone. Propranolol is a beta blocker, originally developed for heart conditions, but decades of research have confirmed its effectiveness in reducing essential tremor, particularly in the hands. It works by blocking certain signals in the nervous system that contribute to the tremor. It's generally well tolerated and has been used for essential tremor since the 1970s. Primidone is an anti-seizure medication that has also demonstrated significant effectiveness against essential tremor. It works through a different mechanism, reducing abnormal electrical activity in the brain. Some patients respond better to primidone than propranolol. Others respond to a combination of both. For patients who don't respond adequately to first-line treatments, neurologists may consider other medications, including topiramate, gabapentin, or now benzodiazepines like clonazepam, though all of these come with their own profiles of side effects and considerations. But here's where the story gets truly remarkable. Because we are living in a golden age of neurological intervention. Deep brain stimulation, or DBS, is a surgical procedure that has transformed the lives of people with severe essential tremor. A neurosurgeon implants a small electrode deep within the thalamus, the brain's relay station for movement signals. That electrode delivers precisely calibrated electrical pulses that essentially interrupt the abnormal firing pattern that causes the tremor. The results can be extraordinary. People who couldn't hold a fork for years pick one up and eat without trembling. People who hadn't been able to write their own name in a decade, pick up a pen, and sign with a steady hand. These are not exaggerations. These are documented clinical outcomes. And now there is something even newer. Something that many people haven't heard of yet, even though it's already FDA approved. Focused ultrasound thalamotomy. This is a non-invasive procedure, meaning no surgery, no incisions, no implanted hardware. Using MRI guidance, physicians focus hundreds of ultrasound beams through the skull, converging on a precise target within the thalamus. The focused energy creates a tiny lesion that disrupts the tremor circuit. Patients who undergo focused ultrasound often describe the experience of lifting a glass of water for the first time in years without spilling a drop on the same day as the procedure. The technology is still evolving. Not every patient is a candidate, and like all procedures, it carries risks that must be carefully weighed. But for the right patient, it is nothing short of life-changing. Research into essential tremor is also accelerating on the molecular level. Scientists are exploring genetic therapies, novel drug targets, and even non-invasive brain transical stimulation techniques like transcranial magnetic stimulation as potential future treatments. The field is moving fast, and the direction it's moving is toward hope. So let's come back to where we started. That morning, that coffee cup, those shaking hands. If that image feels familiar, if it describes you or someone you love, please hear this. You are not alone. You are not imagining it, and you are not helpless. Essential tremor is real. It is common. It is treatable. And understanding it, truly understanding what is happening inside your brain and your body, is the first step toward taking back control. Don't dismiss your symptoms as just stress. Don't write them off as aging. Don't spend years wondering in silence when a neurologist could give you answers and options. If you or someone you care about is experiencing unexplained, persistent tremor, especially tremor that appears during movement, that affects writing or eating or daily tasks, that runs in your family, please talk to a doctor. Request a referral to a neurologist. Ask specifically about essential tremor, because knowledge is power. And the people who get the best outcomes are the people who ask the right questions. Here at Hidden Health Facts, that is exactly what we believe. That understanding your health, deeply, clearly, without confusion or fear, is one of the most relatable important things you can do for yourself and for the people you love. If this video helped you today, please take a second to like it. It tells us that this kind of content matters to you, and it helps this channel reach the people who need it most. Subscribe to Hidden Health Facts so you never miss an episode. And share this video with someone in your life, because you might be passing on exactly this information they've been searching for. And remember, the hands that tremble are still the hands of a life fully lived. Don't let fear keep you from finding help. We'll see you in the next